Hello, my friends. Welcome back to the Fertility Confidence Podcast. Today I have a really fun interview for you with Jane Gleeson, who is an RN and licensed acupuncturist. And she wrote a book with the cutest cover I've ever seen called Who Stole My Ovaries? And I got to sit down with her and ask a whole bunch of questions about TCM, traditional Chinese medicine, about acupuncture, things that my clients are always asking me. And we had the best time. It was such a wonderful conversation. Jane is such a wealth of knowledge, and I love that she has both aspects under her belt of her Western training in the nursing world and then her Eastern training in the TCM world, and how she has just been able to beautifully meld those together to become someone who is an expert in the fertility field and is sought after in her community for acupuncture, and is often getting referrals from fertility clinics because of her amazing success rate and what she does with her clients. So I could just tell by chatting with her, even through the computer, of how warm and caring and empathetic that she is. But she also just had so much to offer us in such a short amount of time that I know that we can definitely have Jane back and get a lot more of her little tidbits from her. Now, I want to give two quick little caveats before you continue listening to the episode. One, trigger warning that we're going to talk about needles. We're talking about acupuncture needles. If that is something that makes you squeamish, that you are not on board with, just click off. It's just at the beginning, so you can kind of fast forward or see if you can work through it. I just felt like, I don't know, some people don't like talking about that stuff, so I just wanted to give you a heads up. The second thing is if you're watching the video, you're going to get to see a very close-up shot of my tongue. And if in your head you're going, why the heck are we looking at your tongue on a podcast, Kelsey? That makes quite literally no sense. I highly encourage you to continue listening on because there is so much we can learn. And Jane had the wonderful pleasure of me having my mouth gaping open in front of my 4K camera. So if you're not watching this over on YouTube and you want to, I don't know, see my tongue, which is kind of weird, you may do that over on the YouTube channel if you're listening to the audio version here from your favorite podcast station. As always, thank you for listening. I hope you enjoy, and I will see you guys in the next episode. Hi, Jane. Welcome to the Fertility Confidence Podcast.
Thank you. And thank you for having me. I'm very excited. You have such a wonderful podcast. Interesting, professional. I love it.
Oh, thank you so much. Why don't we start with you just telling our listeners a little bit about you?
Okay. I was in Western medicine as a nurse, RN, with a master's degree for decades, and then stepped out for a while to get a degree in art and finished getting my kids launched, and missed medicine, wanted to go back, but felt like I wanted to have more tools in my toolbox to help people, and was frankly a little, I wouldn't say burned out. I mean, Western medicine has its challenges, but I felt like so many times people were suffering from iatrogenic disease problems induced by the treatment, by the medications. And also Western medicine had always, had to tell some people, we have nothing more for you. We don't know what else to do. We don't know what you have, and so on. Never had any acupuncture or delved into Chinese medicine. Did some reading, did some looking around, said, I have to do this. This is me. And I could practice independently. And so that was 20 some years ago.
Wow. What a story. You've seen like both sides of the medical community. That's amazing. Mm-hmm. Do you find your Western training comes into your Eastern practice?
All the time. And this is where when people, and clearly Eastern and Western perspectives are different, but there's really, as you probably have learned in naturopathic medicine, there isn't Eastern, Western, naturopathic. There's just good health, good medicine, good approaches. And yes, there are dovetails in things like, the ancients described it poetically. We describe it in terms of lab values, so they really, my next book will be on these touch points, because there's books, Western, Eastern, but we can learn more about it.
Mm-hmm. I love that. I'm such a huge advocate for collaborative care. And I always say that, especially with my colleagues, like, I hope I'm still working in this field, especially in the infertility space. And when there comes a time that we just finally have a full meshed system of it's not one or the other, it's both together. And so to be able to kind of have both perspectives under your belt, it must offer a lot to the patients that you work with.
Isn't that kind of the essence about of naturopathy, that you are bringing in collaborative things from different fields? I mean, that's, and I don't know a lot about it. Maybe I'm misstating it, but that's how I think of it.
Yeah, absolutely. I think it also depends on how you practice, right? With anything, I think there's extremes on either side in every profession, but the beauty of it is, understanding that root cause piece. But like you said, having more tools in our toolkit to explore, to treat, to work on the body as a whole, that's what brought me into naturopathic medicine is also wanting more tools, more options, more things to do that actually focused on preventative healthcare instead of reactive healthcare.
Mm-hmm.
Let's talk about acupuncture, Jane. So, in my practice, before I went totally virtual, I worked in a beautiful clinic. We, as NDs here in Ontario, are trained in acupuncture. By no means do I equate what I learned to what a true TCM practitioner learns. Obviously, our education is more compressed than doing a full TCM degree, but I did a lot of acupuncture in my clinic. Loved it, still love it, still recommend it, and just outsource it to people around me now that I'm virtual. But can you explain to our listeners a little bit about what acupuncture actually is when we use that term, and what should they expect when we're accessing that modality?
On the technical and tool side, as you know, it involves the insertion of very fine needles into points on the body. But the points aren't random. They are chosen based on what we call meridians. Okay, if you can see, this is a plastic lady, and you probably can't see, and you probably learned about this, but there are these lines that go up and down. Those are called meridians. Those are just the pathways that have the points that we access. Now, pathways that are filled with what we call a certain body energy. And that sounds really kind of out there, like body energy. What is that? Well, some of these points are near certain nerves, but I think of it as a pathway of energy that is very similar to electricity. And we know our bodies are filled with electricity from head to toe. That's why you can go get an electroencephalogram, electrocardiogram, electromyelogram. All of these things will come out in electrical squiggles that are actually taking a measurement of how electricity is flowing in your body, whether there's a problem in what we would call chi stagnation in TCM, but it could be a block from anything from a tumor to an injury. So, and we know once again that this energy that the ancients called chi, and some purists, and I'll admit it, some purists will say, no, chi is a separate ethereal body, something in your body. I'm like, no, I personally, you won't read this in a TCM book, I think it's electricity. Everything in our body runs on electricity. Every organ is filled with it. That is why we choose certain ones to measure. And if you remember from basic biology, nerve cells don't actually touch. They have these fingers, if you will, that come out, and that the space in between nerve cells is called the synapse. It's absolute blank space. And when something, let's say you stub your toe and it goes up that chain, a positive electrical charge has to convert to a negative charge to jump the synapse. The positive to negative charge is electricity. No one has ever seen electricity. We see the results, a light, a motor, electric motor, but no one's ever really seen it. I really believe that if that chi, this essence we work with, and I'll get back to the points, is a form of body electricity, and we then open up those channels, help that jump or draw out what might be what we call excess. So the points are not random, and it is something with when you were using it in your practice, and as you were learning, you probably treated a lot of musculoskeletal pain. And so you pretty much There are protocols where you use the ear, for example, for pain in your knee. That's called auricular, but you're going to be trying to unblock, try to get that flow going around the knee, around the shoulder, in the back. Whereas with fertility, there are certain meridians that we get that energy, and we say that the chi moves the blood. Well, every organ's going to work better, including your ovaries and your uterus, if it has a good blood supply. So the chi is the force that moves the blood. And so we would have a protocol that we know from 4,000, 3,000 years that it will move it to there. And that's the essence of kind of how it works. So from a treatment perspective, a person would come, they would lie down and relax. And like you mentioned, when you had done something, a podcast on acupuncture, touched on a few things, sometimes the benefit of just lying quietly. Nobody can be saying, Mommy, you're not checking tax, and we get those points in, and just relaxation is essentially an opening of chi and letting it flow. So a person would lie down for a while and rest. I mean, there's community acupuncture where you're all in a circle in a chair, but I do one-on-one. And the needles would be inserted. Generally, it's I won't say it's painless, but it's not. Most people can tolerate it very well. It's a breaking of the skin that hurts. A good Chinese doctor will go really deep with a bigger needle to get some more ache going on there. I practice more of what we call yin style, more Japanese, Korean, where we don't have to use. I feel I get as good results, smaller needles, not so deep. And so then a person will be lying relaxed or sitting in a chair in a circle, anywhere from 20 to 45 minutes. I did 45 minutes is long, but I was doing birth preparation essentially. We're not supposed to call it labor induction, but it really does help ripen and get the uterus to agree to say, this is fine, it's time I can contractions. So generally, that's what an appointment would be like anywhere. It takes about an hour. It takes me an hour because I don't just put needles in. A good Chinese doctor, seen some very good ones. They don't ask a lot of questions. They might just do a very sort of silent assessment, look at your tongue, look at your pulse. They're good at it. They don't need to. I want to ask questions. I want to know, what did you have for breakfast? Yeah.
Are you going to faint on my table?
Exactly. And I'll have patients say, I had breakfast this morning because I knew you were going to ask me. So my appointments and my treatments do take in all the things we should, as practitioners, be assessing, certainly at intervals, if not at every treatment. So
amazing. If someone is listening and they're like, I wonder if this is for me, what sorts of infertility cases do you find have good success with implementing acupuncture into their treatment plan?
I would say that a number of the fertility patients, and I'm sure you've seen this too, they would be in Western medicine, they would be considered advanced maternal age and geriatric pregnancies. And I find for them that what they need, first of all, is some confidence, some understanding of timing of their fertile window, and not just the LH testing or your app that tells you what time and doesn't even see any of your body signs. They some more education. And then in acupuncture, the points that we say nourish the yin, and the yin is tied into the reproductive energies. And so I would say women who are trying for a first, second, third, fourth child that are late 30s, early 40s, they are very good candidates. Also, even sometimes when I ask people if they have a Western diagnosis and they say PCOS, polycystic ovarian, I kind of breathe a sigh of relief, because that means the eggs are there, they're just not coming out. And with releasing chi and getting blood flow, that's a good diagnosis. I think it's good for any diagnosis, basically. I'm just sort of saying, well, which are the ones where I see really quicker results?
Yeah, that's awesome. What about for men?
Oh, wow. When I was 20 some years ago, when I started, I was all gung-ho. I was going to treat men too. And one of my first patients, it was perfect. He was an ex-professional football player, took too many blows to the important organs.
Some scrotal injuries, perhaps.
As you probably know, that is a reason for
100%.
So I agreed. I was so gung ho. I agreed to to treat him. It was either once or twice a week. If he was willing to, then he already knew his count was like 5 million or 6 million, which for your viewers, that's low. They keep lowering what's acceptable because what's acceptable is what's normal, and it keeps going down. But he had this low count, and we did. I said, if you commit to 3 months, 13 weeks, 12 weeks, whatever it was, I said, I will not charge you if then you agree to have another count done. So my anecdotal evidence, I didn't really have the time or means to set up a big study. So long story short, he committed, he came, his sperm count almost tripled, but it still wasn't quite, I will call it double and a half. It wasn't what was considered normal. It was just under normal. They were getting, as a couple, they were really, as you know, couples are eager to have that baby in their arms. So they decided to adopt. But I did see that nice change. As far as men, sometimes women will say, his libido is very low. First thing I want them to do is get a thyroid checked on the man. I mean, it's very important, just like for women, to have all of your whole, scheme of endocrinology. All the hormones talk to each other. And so after they get certain tests, then I will treat for things that, once again, in TCM, it would be increasing yang. And yang is the heat, light, action, movement. And so there's that. But a lot of it is the teaching of the meditation, because if you're stressed, your libido is going to be low. If you're super busy all the time, your libido is going to be low. So yes, incorporate the man. Also, hey, we are what we eat. If he's eating terribly, doesn't do her that, it's good for the woman. But I like to guarantee people, from the moment of conception, half the genes are from you and half the genes are from your husband. And there is very good research to show that men on a Mediterranean diet, meaning high in fruits and vegetables, have a shorter time to pregnancy than men who do not. So absolutely, I incorporate them from the very beginning.
Amazing. Well, I want to circle back to the tongue piece, because I remember this part of my training, like learning how to read the tongue and using that to help decide our points and give our TCM diagnosis. And it's so a skill I don't have now, because I have not practiced. I have not kept up on it, but I can hear my listeners going, why is she looking at their tongue? So can we actually talk about that real quick? Like, what are you looking for on the tongue? If you are currently trying to conceive and are motivated to use a whole body approach that is going to treat you as if you're more than just a number, then I highly encourage you to come and join me inside our popular Fertility Confidence Bootcamp, kicking off November 27th, 2023, where I'm going to show you a research-guided approach to whole body fertility treatment in a collaborative community experience. I love running this bootcamp, and I hope to see you inside. You can save your seat at www.kelseyduncan.com/bootcamp-registration.
So the tongue is the way the Chinese learned to assess your physicality, not unlike the ear, not unlike the hands in terms of being represented. Different body organs and meridians, lines of energy, are reflected on the tongue. And on the tongue, for example, the major organ systems, for example, spleen, stomach, or bladder, or urinary bladder, or heart, they're assigned geographically a space on the tongue. So, for example, the heart meridian in the heart is at the very tip of the tongue. And so when I look at a patient's tongue and I see a very red tip, I can say to them, you didn't sleep last night, did you? And they say, how did you know? Because the heart is the meridian that can be affected if you're not sleeping. It can go both ways. If you can't get some good sleep, your heart meridian, not necessarily your heart. Okay. And if you have interrupted sleep, it will become redder. Example, yesterday, I treated a patient who is due. I don't do promotion of labor until a person is either on their due date or over and has their doctor's permission. And that part of that is just liability. I want to be sure that, if they were off on the dates, that I wasn't, starting premature labor. But acupuncture doesn't ever make the body do anything it shouldn't do. But she came in the morning and she had big, I call it denuded. The tongue has a coating. Now, sometimes it's gross and thick, and that means your stomach spleen is not clear, what we say, clearing the dampness in your body. Her tongue had, I would say, dime-sized patches in certain areas where the skin looked like it was burned off, but they were almost perfectly ovoid. And I said to her, are you having gastric reflux? She goes, yes, for the first time ever last night. I was, and her baby's pretty high up there. Could have been some pushing on that. I explained it could have been hormones around birth time will start relaxing sphincters, relaxing ligaments and muscles. So some of that can start coming up. But whatever it did, it burned the coating off. And it didn't look terrible. It's just, you look for really subtle signs too. And I encourage all my patients, and your viewers should try this. Look at your tongue, see how it changes day to day. You'll get a thick coat, you'll get no coat, you'll get different odd things on it. We never think about it, but that's kind of it about tongues. It's the and tongues are easy to learn. It's the pulses that, I did part of my internship in China, and they would say you need to be a 9th generation or 7th generation TCM Chinese doctor to really be proficient at reading pulses and knowing what is going on with the body. That's never going to happen for me, but
I was not good at that part either. The tongue part, like I could remember and it's easier. It's so subjective, but you can still get a good consistency of like, okay, that coat looks different than that, but it's the same vibe. Whereas with the pulse, I'm like, I just feel a pulse. Like they have one. That's as far as I got.
I did proficient at it. I'll tell you another reason to look at your patient's tongue when they come in and they stick out their tongue, and I was like, you're back on that sports drink, right? That blue one or the purple one?
They know how to tell. Oh my goodness gracious. I'm going to go up to my bathroom and look at my tongue after we're done and see.
I can look at it now if you'd like.
You want to see? Do you think? Okay. I'll try to get closer and you can tell everyone what's wrong with me.
Oh gosh. Now it looks like you have, this is interesting. On the left-hand side there, you have a little bit of red, but not centrally. In general, your tongue looks good. It's pink and moist, and it should be pink and it should be moist because that means you're hydrated and that you have enough blood. Maybe that's why you have not gotten sick yet. I don't know if it's artifact from being on video, but on the left-hand side on the tip, it is somewhat red. So maybe you just had semi-interrupted sleep last night. But
I definitely have had, last night was the best night I've slept in 5 days. So maybe it's just on its way to healing.
Bring up I think that's exactly it. Yeah. If you had looked at the face, so.
Yeah. I'm going to start having to take pictures and see. My tongue used to be like through training. It was very thick and I had like the best scalloped edging, like textbook scalloped tongue, which has gotten better over time. It comes back when my stress is high, but it's such a funny thing when I'm like, oh, I'm obviously stressed. I should probably look at my life because my tongue is a funny shape.
and more exactly what that means is that when if you're stressed and you're like this, getting through your day, your chi is not flowing well. And chi does not flow. Fluids are not moved well. When fluids in your body are not moved well, the tongue is the barometer. They'll sit in a lot of places, but tongue is one. And then the tongue is up against the teeth. And that swollen tongue is up against the teeth, which makes the scallops. Now, some people, no one sign means anything in particular. It's always what it means in relation to the other signs around it or things that are manifested. And so I always look at the tooth to jaw to mouth ratio. If that is small, in other words, a person has small, kind of a small mouth and big teeth, the scallops for them are natural.
Might be normal. Yeah, totally.
So I'll ask, and some people will absolutely know that that's their normal. They don't know so much normally about their tongue because not too many people look at their tongue.
Right. Well, why would you?
Yeah,
It's just a
right.
tongue. Yeah. Okay. I feel like we've already learned so many good things about, why this might be something people want to explore. So how does a couple that are going through infertility, how do they find the right practitioner for them?
Okay. And you touched on it a few years ago, but I want to just add to that. Licensure in acupuncture has been around for a long time. Back in the 70s, it wasn't. There were some Chinese doctors out in San Francisco and California doing whatever they wanted to do. A group of white guys got together and decided, oh, you're going to be the accrediting bureau, you're going to be in charge of education. Anyway, so certification or licensure and certification evolved. Licensure is the minimum that states require to practice. Certification is something that came along later. And once again, people just kind of grouped together, and they've done a good job of it, but it was necessary, but certification to be certified, there are different qualifications. Like, for example, you have to see X number of patients per year. In other words, you can't be part-time. That's really a good thing. Continuing education credits, that's really a good thing for any profession. And community service, ethics classes, that kind of thing comes into certification. The flip side of that, though, devil's advocate here, TCM is an ancient way of viewing the body and doing things. And continuing education usually goes into what's going on in Western medicine. And that's fine, because we need to do that because we're collaborative, like you were mentioning. Yeah. But as I tell people, and once again, I think you did mention this, ask around, get references, assuming that, licensure is a person is illegally practicing if they're not licensed. Certification is not necessary. And so just find someone with the basics. And then I say, ask around. Don't go with who has the slickest website and the spa looking place. If a name keeps coming up, then check into their background. I do try to prep people that, when I came back from China, I thought, who's going to hire me? I'm not Chinese. Well, my practice filled right away. I think in part because they saw RN and thought, oh, she knows about medicine and stuff like that. So people came. But a good Chinese doctor, won't necessarily have certification. They won't, and it's the culture. You don't, in Chinese medicine, you respect the doctor. You do not question them. They do what they do. You're grateful and you don't question. So to be aware, I'm not saying don't go to a Chinese doctor, but don't go expecting them to sit there and talk to you for an hour. That's not, there may be some, but most don't. So being aware if a Chinese doctor is the one that keeps being recommended to you by people who got the results that you're looking for, go by all means. That would be a good one to choose. And just like with any practitioner, if you go and the chemistry's not right, change. There's so many more acupuncturists than when I started 20 some years ago.
Yeah, amazing. All right, Jane, let's talk a little bit about your book, Who Stole My Ovaries? Can you share a little bit about your book, what it's about?
I don't know if
it's so cute.
Can we start with the cover? Can I tell you about the cover?
Please do. Yeah.
A friend of mine who's an RN, she was a labor and delivery nurse for 20 some years. She decided to go back to school and get an MFA in ceramics. So a lot of her work is informed by what she was spending her time with. So this, I don't know if you can see it, but this is a womb, the uterus, probably of a baby because it's big. In Chinese, we call the uterus a vessel, the conception vessel. What is a teapot? A vessel. The handle and the spout are the fallopian tubes, and you can see the fimbria around them and then the ovary. The teacups are the process of meiosis, like after fertilization. One cell becomes two becomes four, and so on. Those are the cups. Her other, she's been doing this for years now, so she has evolved, but she did ceramic speculums, pelvis bowls, all of these things that unless you knew anatomy, knew reproductive stuff, you might not know what they are. That's the artsy part of them.
That's so cool. I would have that stuff all over my house.
Her name is in here if you want to look up.
I will have to.
But I wrote this book. I was inspired to write this book in part because COVID hit and a lot of the fertility clinics closed down, at least for a while. And I thought, well, this is my message from the universe to retire. I'd been in nursing for 3 or 4 decades and then in fertility for 2. And I thought, okay, I want to spend more time with my grandchildren and I want to do this and I want to do that and that. I am going to, my advice that I would give to people, put it in here. And then when I have to be sad and say, no, I'm not taking any new patients, so I can't see you, but I put some stuff in a book. Now, I have always felt that by the time people come to, and it might be different in as a naturopathic doctor, but for acupuncture, they kind of don't usually come right out of the gate. They're like, oh,
Right.
well, I had problems. So usually things have gone on, they're complex, and they've already read a lot of books, done a lot of podcasts, looked a lot. And I wanted them to have one-stop shopping because I didn't want to tell them, oh, do this, read that. Although I do tell people about your podcast.
Thank you.
So it's in sections about, and I based it on the questions I have been asked for 20 some years.
I love that.
Yeah. And so it's about restore the section head is restoring spirit because people are pretty low spirited they've been on the treadmill for a while, revitalizing the physical you, refreshing you in your home. I didn't want to say, oh, endocrine disruptors, getting away from them. This is refreshing. This is, hey, there's research to show you can get some of this out of your body, not all of it. All the reasons to do clean nesting, as I call it. I have rebalancing and next steps. It's got every sort of major area that people ask questions about. And when they ask me, can I have caffeine? They trust me, as you probably know. They've already read everything online about it. They've asked other people. They want to know what you think about it. Yeah. And if they respect you, they will read that. So it was designed to be kind of a one-stop shopping, cover all the things, but based on the questions that I have gotten from people for years. So it's an easy read. It is available on Amazon. I'm in Milwaukee, it's in bookstores here. And it's my gift to the patients I'll never see. And
I love that.
Yeah. I did try to mail one to you. Did you ever get it?
Oh, I did not get it, but I will connect with you. I'll get Megan to email you after and make sure. Cause I was just thinking in my head, I'm like, why don't I have this book? I should probably go buy one. That's pretty rude of me.
It's my book marketer that gave me your address. It's in Ottawa, right?
No,
That's
okay. We'll connect with them. I will get my hands on this book, and I'm going to link a copy of the book via Amazon in the show notes here. So that everyone else can also grab their copy of Who Stole My Ovaries. As we wrap up here, Jane, this is how I end all my podcasts. What is one piece?
Half an hour already?
Yeah.
Okay.
This is how it goes with me.
That's okay.
What's one piece of fertility advice that you would love to leave for our listeners?
Okay, so fertility advice, not necessarily acupuncture advice, fertility.
Any fertility advice.
Just keep trying. And you'll know when you're ready to go down different avenues, but just keep trying. Have confidence in your body. Listen to your body. And I know yesterday's podcast was on fertile mucus, and you know how many people come and they'll say, fertile what? Mucus what? The body knows more than tests or apps that may or may not be the total story. So yeah, have confidence, keep trying.
I love that. Amazing. So we're going to link your book. Is there anywhere else people can find more information about you, Jane?
On my website, janegleeson.com. When I thought I was retiring and I came out of retirement, I kind of slimmed down my website, and it is primarily about the book. But my Instagrams, because that's quick and easy, they're not your typical Instagrams. I don't believe so. They're, I think, but valuable stuff. So it's for Fertility Expert Jane.
Amazing. I will make sure that gets linked as well. Thanks so much, Jane. This was wonderful. And hopefully we can have you on again.
Oh, that would be great. That would be great. And thank you. And I hope your kids are feeling better soon. And your family.
Oh gosh, you and me both.
All right. And check your tongue in a few days if you slept well.
I will. Thank you.
You're welcome. Bye-bye.